Today is day 19 of Alert Level 4 lockdown, and I'll start as I usually do by handing over to the Director General of Health to give us an update on today's cases. Dr Bloomfield.
Thank you, Prime Minister. Tēnā koutou katoa. So today we can report 19 new cases of COVID-19, and this comprises 15 confirmed cases and 4 new probable cases. There are now 546 people who have had COVID-19 infection who have now recovered. This is an increase of 75 on yesterday's number. The new combined total of confirmed and probable cases in New Zealand is therefore 1,349. Today there are 15 people in hospital. This is an increase of 1 from yesterday. This total includes 4 people in ICU in Wellington, Middlemore, Dunedin and North Shore hospitals. One of these ICU patients in Dunedin remains in a critical condition. Yesterday there were just 1,660 tests processed in our laboratories around the country, so the total test to date is 62,827. Now we were expecting a drop-off in testing over the Easter period. This is a pattern we see in terms of people seeking healthcare on public holidays in usual circumstances, and therefore we've seen that happen over Easter. There has been testing available for people through CBACs and of course through general practice or after hours clinics. The other thing that I think is happening here, and I checked this with our Chief Science Advisor, Dr Ian Town, who is a respiratory physician, is of course with the Alert Level 4 measures we have got in place, we will see much less opportunity for the whole range of respiratory illnesses to be transmitted between people. This would include influenza and also common colds. So we would expect less people with respiratory symptoms that might be suggestive of COVID-19 seeking care and therefore testing as a result of those symptoms. So the CBACs, as I say, the community-based assessment centres are widely open, and around the country we now have 77 active and 54 designated general practices, swabbing centres and mobile clinics. I am also saddened to report today there has been a 5th death linked to COVID-19, and this is also associated with the Rosewood Rest Home cluster, the 3rd death associated with that cluster. It is a death of a man in his 80s. He was one of the residents who was being cared for at Burwood Hospital in Christchurch. His family are of course in our thoughts, and we offer sympathy and support to them at this time. I do ask that the privacy of both this family and other families who have had deaths associated with COVID-19, that their privacy continues to be respected. We know that because of the underlying vulnerabilities of members of this group, we need to be prepared for further serious illness and possible deaths. The care that this group of people who were transferred from Rosewood Age Residential Care Centre to Burwood is a high level of psychogeriatric support and care, and this is the same care they would have received at the facility they were at, including, where appropriate, end-of-life or palliative care. Overall, there are now 33 COVID-19 cases associated with the Rosewood Age Residential Care Cluster. Of those, 17 are confirmed and 16 are probable cases. All 3 people that have died were confirmed cases. We're also aware that 13 of the 33 cases of the facility 13 were residents and 18 are staff, with 2 connected through close contact or through family transmission. Of the 18 staff cases, 7 are confirmed positive and 11 are probable. And one of the new cases is a staff member who is actually working at Burwood Hospital, and the DHB is investigating the route of transmission that led to this person getting infected with COVID-19. What I can say is that all staff involved in the care and transfer of those people from the rest home were using appropriate PPE. What it does show is that even with PPE, this does not automatically prevent people from becoming infected. PPE needs to be used appropriately, and likewise it is not a fail-safe. So there is a very low threshold for investigating staff with any symptoms and or testing. And I've just spoken with the Medical Officer of Health down there, and they will be doing wide testing of staff and others who may be involved in this cluster over coming days to check that there are no further people that might have infection and be pre-symptomatic. Finally, in terms of clusters, we now have 15 clusters that are above the threshold. The additional 2 have just reached that threshold of 10 cases. One of these is in an aged residential care facility in Auckland, and the other is a small outbreak in Christchurch, and we're just getting further information on the nature of that outbreak. And finally, just to let you know, I'll be doing a Facebook Live session today at 2:15 with a focus on answering as many questions as I can within the time allowed that New Zealanders may have about COVID-19, and this will be done through the Ministry of Health's Facebook page. Thank you all for your ongoing support, Prime Minister.
Thank you, Dr. Bloomfield. I hope, despite the obvious restrictions, that you have still been able to observe and acknowledge Easter in a way that is meaningful to all of you, be it the online church congregations, backyard Easter egg hunts, or simply coming together for a special meal either within your bubble or with others virtually. From what I've seen, New Zealanders have been pretty creative in the way they have marked Easter in spite of the circumstances. But as you have just heard from the Director-General, we have been reminded yet again these past few days why we are doing what we are doing as we share news of another death in New Zealand as a result of COVID-19. It is a timely reminder that our battle with this virus is far from over. While overall case numbers have continued to fall, even one case can become many. Our clusters have shown that this simple act of coming together for a social occasion, something that previously would have been considered normal, can lead to more than 80 cases, as we have seen. And even more deadly is if the virus reaches people in vulnerable communities like rest homes and aged care facilities, where 3 of our 5 deaths have occurred. We've been lucky to date that the virus is not evident in some of our communities where people often live in close quarters and in larger numbers, but that too poses a risk if lockdown is lifted before we have firm evidence the virus is under control and that there isn't silent community transmission. Our number of cases may be small, but that doesn't mean we have yet been successful in hunting this virus down. One positive can be indicative of other cases in the community. That is why we must keep going. And that's something I wanted to remind everyone of today. As I've said before, we are definitely not in a position to move out of level 4 early, and nor can we afford to change anything that we are doing while we are here. I say then to those who broke the rules this weekend, it could take one case amongst you to have an outbreak that could lead to dozens of infections and possibly death. New Zealand does not take this challenge lightly, and nor should you. Secondly, while we all want to lift the restrictions as soon as we are in the position to do so, that decision will not be taken until the 20th of April. We need to use the most up-to-date live data that we have, and we will. Thirdly, if and when we do move, level 3 will have significant restrictions also. We should consider it a waiting room, a place we move to that allows a bit more activity to occur, but not so much that we risk losing all the gains that we have made. This is the place we go while we check that we have genuinely got things under control and that we are on track to stamp out the virus. That then allows us to make decisions around whether we are ready to move to level 2. As I've said recently, while our focus this week remains on shutting down the pathways for the virus to spread through testing and rigorous contact tracing, we will also this week be setting out details for each of the alert levels. So let me run through what this week looks like, especially what you can expect in that regard. Tomorrow, the Treasury will release a series of economic scenarios of the potential impact of COVID-19 on unemployment, GDP, and the ability for the economy to recover. In addition, the Treasury's weekly economic update will now be expanded to include additional indicators of economic activity in order for there to be regular and up-to-date data on what is happening in the economy. On Wednesday, the Finance Minister will deliver an online speech to Business New Zealand, setting out the next steps in our plan to cushion the impact of lockdown, including further measures to assist businesses. He will also set out our revised approach to Budget 2020. On Thursday, I will release further details on what Level 3 and Level 2 will look like beyond the framework we set out some weeks ago. And everyone will remember the alert table that we have been using to date, but we want to put more detail yet again behind that. That detail will include for businesses, for transport, for health, for recreation, for education. I understand the importance of this information for businesses and others to plan. And even though we'll be releasing that detail on Thursday, in between times in the lead up, we will be talking to sector leaders as we finalise some of the details around these different alert levels beyond what's already in the public domain. We are very aware of the need to get more of our economy running as soon as possible, and I know Level 4 will be getting harder and repetitive for everyone. I do not underestimate the stresses and strains many of you will be experiencing at home the longer this goes on. Week 3 may in fact feel the hardest. We're coming around the bend, but we can't quite see the finish line. But our job this week remains the same and as important as ever. As I said last week, New Zealanders' efforts have been huge. Because of your work, we are in the position that many other countries are not. But now is not the time to deviate. As the Minister for Sport recently said to me, we can't squander a strong half-time lead by letting up or getting overly confident. Please stay home. Please stay in your bubble. Please help to break the chain of transmission to save lives. One last word of note. This morning, like many of you, I saw the reports of Nurse Jenny from Invercargill being credited by Prime Minister Boris Johnson for his recovery. We have thanked our frontline health workers in New Zealand many times, and rightly so. But I wanted to add an acknowledgement that many, many Kiwis work in healthcare around the world. They show the same commitment, same care, same work ethic that they do here, and we are all very proud of them, especially of you, Nurse Jenny. I'm happy now to take questions.
So have you reached out to Nurse Jenny?
Yes, using the informal tactic of finding her on Facebook and sending a Facebook message.
Can you reply yet? Or?
No, but nor would I expect to hear back from her necessarily at all. She's obviously on the front line, and I imagine will be very focused on her job.